It's Wendy Bowen, physiotherapist with Know Your Body Better. So I was asked to speak a little bit about repetitive strains. So there are three ways, again, that your body is going to break down. One is trauma, slips and falls, car accidents, sporting injuries, those types of things. So you've had trauma. The second way is postural or sustained strain. Remember, if you're sitting like this, you're going to get extra strain through here, and in your lower back, you'll feel the strain. And then there's repetitive strain, doing something over and over and over again without giving it appropriate rest or recovery time. And so the analogy that I like to use with that is, our tissues, if this was a tissue, you bend it, straighten, bend it, bend it, bend it. If I kept doing this over time, now this is pretty tough plastic, but if I kept doing that over time, I'm actually going to cause a fracture in that, and then it's going to break down. Our tissues, unlike this, do have the ability to recover, but you have to give them some rest time. So there are things you can do to try to let them recover. One, change the activity you're doing. So if you're a runner, add in some cross-training activities. If you like to do your boot camps, maybe add in your yoga. Remember the softer stuff. So change your activities from what you're doing. I know with weight trainers, they don't just train their lower body every single day. They might do their lower body, their upper body, their core. They switch it up a little bit to give themselves a few days of recovery. When you're younger, you're going to recover faster. As you get older, we tend to recover slower. What used to take an hour and a half to recover may take us a day and a half. There are some things you can do nutritionally, and I advise you to consult with your naturopath or nutritionist to look into those. I know I do a little recovery cocktail at the end of a hard workout to help with the rebuilding of the tissues. The other thing is to keep them more supple. So again, nutrition can help with keeping the collagen supple. And I use a supplement as well to help with that. So there are some things you can do from the nutritional standpoint, but the biggest thing from the physio standpoint is change up your activities, add some relaxation activities in there, and give yourself the rest time. So because if you're bending something over and over and over again, it's going to break down, and eventually you're going to have to stop and rest. So going to give you a little stretch, remember. So a lot of one is the tennis elbow we've talked about. So the stretch I like to do for that and the recovery is to bend the wrist, pull it down, curl the fingers under to stretch the tissues in here that we've been using too much. The other thing I like to add in for people with repetitive strain, I do a little IMS, we do a little massage, and if the tissue's tight and it's gotten thickened down, we might do a little shockwave therapy. If there's inflammation, I'll do the ultrasound or the laser. So it's Wendy Bowen, physiotherapist with Know Your Body Better. Give yourself appropriate rest and recovery time and prevent those repetitive strain injuries.